Ladies and gentlemen, welcome to another episode of AskHowAbout. I'm your host, Pranay J. Reddy, as usual. Today, it's going to be a slightly different episode because we thought we need to do an episode on mental health today. And I personally felt like if me doing a funny monologue or adding jokes here and there would not be adequate for the tone of the show. We wanted to keep it a bit sentimental and serious as well because this topic, as of recent events, I'm pretty sure you all must know, it's come into light. How important it really is, and I believe that recent events have just been a wake-up call, or rather an alarm clock just ringing, and we need to do something about it. We never truly can understand what's going on in another person's head. It's not a physical injury, right? So we thought that's why this episode is absolutely necessary right now. So people understand what it's like for a person dealing with mental problems and how we can help them and how we can be with them to make sure they get through it, to the other side where they feel better again. Because trust me, it's human nature to go through that. So that is why we brought in a clinical psychologist, Dr. Mini Rao. She is a clinical psychologist by practice. Her research areas include diagnosis and treatment of mental dysfunctions and disorders. And most notably, she's a TEDx Star Award recipient. She got a doctorate from University of Madras. She has over 150 articles appearing in newspapers and magazines. She's the recipient of Women's Exclusive Award and Women Achiever Award. Furthermore, she's the ambassador of Chennai Turns Pink Breast Cancer Awareness and also an ambassador for United Nations Peace Federation. She's a spokesperson and a crusader where she educates children infected with HIV. And she's appeared on many network channels and radio stations. Now, as you can see, she's clearly an expert and she would know what she's talking about because she's been dealing with stuff like this for many years. Now, as for me, I wrote something recently where actually it was before all this stuff about mental health happened, but I think it's very relevant right now. So let me just read it to you. The number one is unique. Its value is just one. Yet it stands at the top. We want to be number one. Yet we forget it's lonely at the top. It's also a number worth fighting for. No one is truly alone if we all fight to save that number one. Even one is worth fighting for. Everyone is worth fighting for. But what do I know? I'm just a comedian. And so with that, I'd like to go straight to the interview with Dr. Mini Rao, where she talks about all of this and she talks about why it's so needed for all of us to understand why mental health is so important. Here's the interview. Dr. Mini Rao, thank you so much for joining us on the show today. I really am glad to have you. And first off, ma'am, how have you been doing? I heard he had a birthday recently, so how was that? It must be good.
Pretty good. It was a nice family celebration, no outsiders. It was very nice. Just my in-laws, my sons, my husband and my dog. We cut a cake, we had good food and then we slept. A nice, neat, simple celebration.
Well, I mean, especially during the lockdown right now, any celebration is welcome. Would you want to say?
Well, true enough. Better to be safe than sorry.
Definitely. And so, ma'am, speaking of better to be safe than sorry, mental health, obviously. It's always better to seek out help before you get affected mentally. So before we go into too much into those details, I just want to ask this as a general question. Mental health is a tricky subject, in my opinion. And we as human beings are very different from one person to another. Let's say my thresholds of emotions, your thresholds of emotion are very different. And rightly so, because they're based on our experiences. But that's why I wanted to ask, is there any one person who's actually mentally healthy in this world at all?
There is no such thing here. There is no such thing as a perfectly happy man or a woman. See, everybody goes through ups and downs in life, right? So everybody experiences death, divorce, any negative experiences. So there will be downfalls. Okay, so they will get affected, they will get depressed, they will get anxiety attacks, they will get panic attacks, they will feel sadness, they will feel the loss. So at any given point in time, a person will feel some kind of mental health issues. You can't say
Well,
that a person will be mentally happy all the time. That never happens.
all right. Well, firstly, the reason why I asked this is because I want to break that barrier of being mentally ill is a sense of not normalcy. Yeah, people do go through it, and that's why I thought it was a relevant person to ask. And more than that, ma'am, if you, for example, let's forget that people are stigmatized towards seeking help for mental health. Let's forget that for a second. How would a person know if he or she is going through something mentally? How would you make them aware of that?
They would definitely know what they're going through. But the thing is, they're very ashamed to admit to it. So, what I can tell you about some telltale signs, of close friends of theirs or close relatives of theirs. Okay, the signs that they can look out for in a person who's suffering from mental health issues. They will tend to sleep a lot. They will not want to communicate. They will try to socially isolate themselves as much as possible. They won't show interest in anything they were interested in before. Okay, so they will show all these symptoms, and these family members and friends should be a little more perceptive.
Okay.
In recognizing these symptoms. I know it's very hard. See, externally you can't see any symptoms, right? They will be very cheerful in front of you, talk normally in front of you, but you have no idea what they're going through. So these are few symptoms and signs that you can actually try to see or perceive, and then try to talk to them to find out if they're going through something. Mostly, it would be great if the person who's undergoing these symptoms try to reach out to a professional.
Yeah, that is what I want to talk about for a moment. Like the symptoms you said, these are symptoms we can look out for people who are mentally ill or not well. But what goes on in their head, none of us do know, like you rightly said. And even if we do identify such symptoms, unless that person wants to identify him or herself as mentally ill, I don't think we can go through that barrier, can we?
No, the only thing you can do, sometimes it's very dangerous for friends to advise that person, that mentally ill person, because it can lead to other dangerous consequences. They can make the situation worse. So the best thing they can do for their friend is to refer them to a professional. We are educated for a reason, yeah. We are skilled for a reason. We are there to help, and they should recognize that. We will treat them well, and we will make them cope with the situation and make them get away from what they're suffering from.
So, moving towards the point where people who come willingly to seek your help. You've been a clinical psychologist for many many years, and so you've seen people who come to you willingly, saying that I do need help. So, I want to ask you, what made them aware of their mental illness?
What makes them aware?
Yeah.
Yeah. Okay. So basically, first of all, they wouldn't want to get out of bed first thing in the morning. Okay. They won't have any incentive to do anything. Have a bath, cleanliness, absolute lack of hygiene. They won't take care of themselves. They will have a lack of appetite. They will have sleep disturbances. They won't be able to focus or concentrate, or their attention will be lacking. They will have suicidal thoughts. There are so many things that they will go through. Agitated feelings. They won't be able to function on a day-to-day basis. Their personal and professional life will be affected. When that comes to that extreme, then they realize something is wrong with them, and these symptoms that I'm talking about have to last at least for 2 weeks. See, temporary sadness or temporary incident which makes you want to cry and you get over it, that's fine. But if these symptoms that I'm talking about, feelings of hopelessness, frustration, helplessness, wanting to commit suicide, all these things, if they last for 2 weeks, you need to be diagnosed by a clinical psychologist and you need to seek treatment.
So,
The 2 week period is the sign.
so did these people tell this to you when they came to seek your help, or were they having some other issues which they were talking to you at first?
It
I
happens
just
both
because,
ways.
sorry.
It happens both ways. Sometimes they are very direct when they come to me. Sometimes it takes a little while. It's called probing. I start probing and then I come to the real issue. Initially, they don't. Some people don't directly talk about the issues. They feel very shy or embarrassed. So what happens is I get them to come back to the core issue, what they're suffering from, and we take it from there.
Well, then talking about today, ma'am, in the sense like how mental health is perceived today. I personally do believe, and I think you agree with this, the stigma of mental health, seeking help for mental health is reduced. Would we say that's true?
Definitely. I'm a lot happier now than I was 12 years ago. 12 years ago, there was like, nobody wanting to seek help. They were embarrassed to walk into a psychologist's office. Everything used to be done very secretively over the phone. And, nowadays, a lot of people are seeking help very openly. The change is happening, but it's happening slowly. So I think it's a very good trend.
Well, that's definitely encouraging for me to hear, and I'm pretty sure for our viewers as well, that is an encouraging sign. But there's also one thing I wanted to ask. Cases of mental health have also risen. Maybe because, like you said, awareness or maybe openness of people to come. But I also wanted to ask this question. Does today's environment or rather lifestyle contribute to that
Definitely, our lifestyles do matter. No, now people lead hectic lifestyles. They don't have time for anything. They come back from work, they're tired, they watch TV, they binge watch, and then they go to sleep. Next day, back to work. No, they have to make lifestyle changes as well. No exercise, no proper diet. Okay, no, doing you have to follow a routine. That is not happening in the present hectic lifestyle that these youngsters lead. That's what is leading to a lot of mental illnesses at such an early age. A routine, discipline is required, a controlled discipline routine, which they are not following.
So, is there any truth to the fact that I don't know if this is true or a myth? I just want to throw this fact out there for you. People do say that our older generation was much more mentally resilient. Now, is
Okay.
that true at all, or is that just a myth?
I don't suppose they were resilient. Yeah. I think they were just completely, totally unaware of what mental illness was. They didn't know who they were. They didn't know what a psychiatrist, who a psychiatrist was, what they would do to them, how they could help them. They were totally clueless. Okay, even if they did have depression, even if they did have a panic attack, they somehow managed to cope on their own because they didn't know where to go and what to do to reduce their symptoms or to make themselves feel better. So I wouldn't say more resilient. I would say lack of awareness.
I see. I see. So, yes, so I was also going along the same lines as well. That was my thought process as well. And that brings me to a question of today. And today, in the sense, like, people, like you said, lifestyle does play a huge role. And medication is something I see people are now fighting against. Medication from therapy. So, let's say you suggested a medication, they actively try to avoid it, or rather, they overuse it. Why is that, do you think?
Okay, there are two ways to this. One is people have total misconceptions about a psychiatrist and a psychologist. Okay, the difference between us is psychologists have doctorates, PhDs, whereas psychiatrists have a medical degree, that's an MBBS, and an MD in psychiatry. So we're completely different. While we psychologists can only, give different kinds of therapies, psychiatrists can prescribe medication. Okay, so what happens to these youngsters? They aren't even prepared for therapy. The minute they come to me, they think in one session all their problems are going to get solved. I'm not an overnight miracle healer, and therapy doesn't work that way. Depending on the individual, the sessions will go on until they can until they can cope by themselves without my help. That can even go on for years. I have a patient who's been coming to me for the last 8 years. Therapy starts becoming something like an addiction. Okay, you wanting to talk to that person, you wanting to get their validation, it really becomes an addiction, and that's much better than medication. See, medication has side effects and after effects, right? Whereas therapy has none. All you're doing is talking to someone who's willing to listen to you. That's all you're doing, unburdening all your worries, anxieties onto them. That's all. On the other hand, I have people asking me for medicines. I'm not a psychiatrist. I can't prescribe medication. Just give me sleeping pills for the moment. They want quick fixes. This generation want quick fixes for everything. Overnight therapy, just give me 5 sessions together. Therapy doesn't work like that. You cannot have more than 2 sessions per week. There has to be a follow-up period. They have to listen to the whole conversation that you had. They have to think about that, and then only we can have the next session. They have a lot of misconceptions about what to expect from a psychologist, which is very difficult to explain to them. So I have this session, the first session called the breaking session, where I break all the taboos about what they think about therapy, what they think about the psychologist, what they can expect from the session, etc. And then I start on to the next sessions.
So, can you take us through a little bit about your plan on how you use therapy for every patient? In the sense, like you said, there's a timetable, there's a plan through which you go through, so that the person can get to think, and also it's not like one therapy session every day. So,
Yeah.
what goes through that thought process for you is something I'd like to know.
The thing is, I have a plan for each individual person depending upon their problem. If it's mild to moderate symptoms, I can handle them. If it's very severe symptoms, I refer them to a psychiatrist I've been working over the last 12 years with, a very good psychiatrist. Because in some very severe cases, you do require medication. You just cannot skip it. So what I do is when people come to me with mild to moderate symptoms, which I can find out through psychometric tests, whether they are mildly depressed, moderately depressed, or severely depressed. Through them, I can find out, diagnose them with that particular kind of symptoms. And then when I start the therapy session, like I said, I have a breaking session with them. I build a rapport with them so that we connect. They know what they are talking about. I know what I'm talking about. We have a plan in place. Okay, so you come to me for the first session. After a period of 5 days, think about what we've said, and then I give them a list of things to do. It's not that difficult. Just 5 different things depending on their problem. It can be anxiety. It can be insistent thoughts, obsessive compulsive disorder, they say. So I give them a certain list of things to do, so that reduces. I teach them meditation. Okay, so once they finish all that, they come to me for the next session. So then after that, from that session, I take it on to the next session, each depending on their level of improvement. If they digress, then I go back to stage 1.
I see. I see. So, from this, I want to move on to an important question. I think is important to discuss. More like family therapy. Family therapy I see is needed nowadays, in the sense, like, not a lot of families are genuinely happy, and the people I see getting most affected are the kids. They're just kids who are brought into this world, and then problems due to the father or mother, the kids tend to suffer. And do you think that's a contributing factor to why the number of kids needing therapy has increased recently?
First of all, I would like to say parents need counseling first. Okay, that's not happening. Most of the troubled kids who come to me, most of their problems are due to childhood. Okay, in general, psychiatric illnesses, most of them, okay, are because of childhood abuse. Okay, verbal, emotional, sexual, everything. Okay, most of the illnesses are attributed to childhood. So the past is very, very important. For a child to have a very good, secure, stable past will reduce the risk of mental illness for a child. So the parents definitely are to blame. If they don't give them that kind of stable, secure childhood, obviously the child is going to, have some kind of issue later on in their adult life.
I want to follow up that question with another question. Do you think the parents are that way because they were treated early even when they were kids? Would that be a possibility?
That actually works again 2 ways. Some parents actually learn lessons from that, not to be like that, whereas some parents are very perverse enough to treat their kids exactly the way they were treated, which is very unfair. They think their parents were role models and that's how their children should be treated, which is a very, very wrong thing to do. I would suggest take lessons from how badly you were treated and treat your child with respect. with trust, with love, with care, they will grow up to be normal adults without any issues.
And again, staying in this family therapy, what about women who go through domestic abuse and domestic violence? How do you think? Because I've genuinely seen women who have suffered a lot. Not just saying men haven't suffered as well, but when women go through domestic abuse, I can personally state that it's not easy for them to recover. And so, how do you think they go through it in terms of handling it mentally? Because a mental scar is much more harder to get over.
Very, very true. See, physical scars, when you get beaten, they will obviously disappear after a while. Emotional scars will last you a lifetime. Okay, so I've seen a lot of abused women coming to my clinic. What I do is talk to them. Most of the time, they just want to unburden their, the whole ugly scenario of their marriage, how they get ill-treated, not just by the husband, by the in-laws. And most of the time, not being, let's say, judgmental or whatever, most of the time the problems are caused by the in-laws. Okay, the in-laws provoke the husband ends up hitting the wife in order to please the parents, because the sons have a guilt complex towards their parents. Their parents have brought them up with a lot of difficulty. Their parents have done so much for them. How can you disrespect them? They don't think in terms of, she's the new member of the family, let's welcome her properly, treat her well. They don't think on those lines. So what I do during these cases is to bring the husband in, have a couple of sessions with him to actually explain to him that he and his wife now belong to each other. A marriage is between families, but a marriage is also between two individuals where in-laws shouldn't interfere. Okay, although several sessions have gone bad, where the husband defends himself on his wife's behavior and that's why he hit her. I completely don't agree with physical violence, but it's going to take a long time for men to actually understand these things. And, so till that time, I keep consoling and keep counseling the woman as to not to provoke the husband and to keep quiet, and so that the violence will decrease. There is no other way a woman can sustain herself in this kind of a position.
Just to put this in perspective, do you think the cases have slowed down, or rather the conditions are improving in newer marriages?
No, I think the cases have always been a lot. People coming forward has been a lot these days. It's always been that way. Nowadays, women are becoming more bold, and they're approaching a psychologist and coming and telling the world that they're getting abused on social media. They're becoming very bold and public about it and vocal about it, which I'm very, very happy about. Before, they used to be very closed and very nervous to talk about it. Nowadays they're very open. At least most of them.
So, ma'am, for people, I know I've said, and you also said how it's a positive trend and how people are trying to, or rather seeking out help willingly. But there's still people seeking therapy sessions, stuff like that. So, for them, at least, I want to ask you for some tips or advice on how maybe their friends or family can help, other than the fact that, maybe just noticing their symptoms. Can friends and family about that?
Don't be embarrassed, go seek help. It has to come from within a patient. You can't force someone to go to therapy, because therapy doesn't work that way. That person will have to find the need to come and see the therapist in order to get rid of the trauma or agony. Okay, a forced session is never going to work, because they're not going to be able to talk to me. What will I do in the session? Unless I get to have a conversation, I will not be able to give them any solutions. So no amount of others' intervention or help is going to solve matters. The whole thing has to come from within. I need help. I need to go for therapy. I need to feel better. I need to be more productive. I need to give to society. That kind of thinking has to come from the individual. No amount of forcing or convincing is ever going to make it. That's going to be very temporary.
All right.
Just for the sake of coming to therapy to please their parents or their friends is not going to work.
All right. So, one last question I'd like to ask you, ma'am, is not necessarily about people seeking help. It's more about a person's mentality. Now, when a person needs therapy, I'm pretty sure most people do understand when they need help from outside. But people are more controlled, or rather, think that they'd rather not be perceived a certain way. So, and that bothers me in the sense like you as a person who need help would rather, are concerned about how you're perceived than getting help for yourself. So, I just want to get your opinion as a person in that field. Why does that opinion matter so much to us as a
But do
population?
you really blame them? We are such a judgmental, narrow-minded society. Okay, this one will talk about me like that. That one will talk about. We are very, very conscious of society. We are scared of society. Who will marry me? Take a woman for an instance. Who will marry me if they know I've been to a psychologist or a psychiatrist? It's that kind of a mentality, and it's very sad to see. But nowadays what's slightly better is, I have phone sessions. For the last few years I've been having phone sessions, so they can't see me, I can't see them. So I don't know their name, they know me obviously. So we have phone sessions where it's anonymous. They can talk to me about anything, nobody needs to know. Because in case, and there's obviously a confidentiality pact where I can't reveal any details about them to anybody. So these phone sessions are helpful for people who do not want to be seen in a psychologist clinic or want other people to know that they're suffering from a problem. So phone sessions work, but I would advise people to come out openly. See, when you have a stomachache or a headache, you casually walk into a physical health doctor's office to get a medicine and you feel better, right? Why can't you do the same when it comes to trauma or panic attack or like anxiety or severe depression? All you have to do is walk in, you have a therapy, you have medication, you have everything there to help you. Yeah, why can't they understand that? Why the stigma? Imagine in the US, people actually exchange their therapist numbers. They say, "Why don't you see him? He's been really good for me." I wish our country would actually come to that stage where they're confident enough to boldly walk in to a psychologist or a psychiatrist clinic to just talk about the issues. There is nothing wrong with it. You don't have to be mad, psychotic, crazy, or lunatic to come to a psychologist's office. Every individual, even me, all of us have issues. It's just that we are more qualified to help us. That's all.
Well,
So I would just wait for the day when we lose this stigma.
Well, so am I, ma'am. And now, especially, people are trying to, or rather, willing to open up about their problems, like you said. And I guess that is what we want to conclude this interview on, the fact that please stop being so judgmental about anybody trying to seek mental health. It's something which you cannot. I think the stigma arises from the fact that you cannot see the hurt. When somebody gets fractured, you can see that they're physically in pain.
Very
But
true.
when someone's hurting mentally, I don't think people can see what that person is going through. And so you can never understand that person's pain. It's their mind, it's their brain. There's no way we have a right to judge them based on what they're going. And so,
Absolutely, on the dot.
ma'am, that's why I guess, this is an important topic, not just now. I guess this topic, like you said, I think you told us this before the interview that it's a topic which needs to be had a discussion on every time. People need to talk about it. I guess the stigma goes away once you start to openly talk about it, to discuss about it. Then the stigma will go away. I guess
Yeah, I just
that's
hope just incidents like this, like the death and coronavirus, all temporary things, come and go. And after this, again, mental health and mental illness are shoved to a corner. I hope that doesn't happen. Mental illness and health are here to stay, whether you like it or not. And most of the mental illnesses are hereditary. Many of them don't even know that. Okay, so there are going to be endless amounts of mental illnesses cropping up in the future. Hopefully, people will, have the guts to come and, seek the intervention of a psychiatrist or a psychologist to get to feel themselves better and get well soon.
well. That is a lovely note to end on, ma'am. And I guess we would end on that note. So thank you so much for doing this with us. It really means a lot. was that's an enriching interview for me personally to get to know about stuff even I didn't know about. I'm pretty sure the viewers really do appreciate you also.
Thank you very much for having me. It's people like you who are bringing about mental health awareness, yeah, and it's very, very much needed right now in our country. And you did a great job today on enlightening people about it. Thank you so much. It was a real pleasure.
Thank you, ma'am. Thank you so much for being here. Well, that concludes the interview. I sure do hope this has been an enriching experience for you to understand what it's like for people to deal with mental health problems. And one of the things that you could see in the interview, every one of us could have been that one person mentally affected. And it's not nothing to be ashamed of, it's nothing to be afraid of. We go through such problems. Every one of us does in every stage of our lives. And sometimes all we need to do is just sit and talk, or for another person to just listen. And that to me surely will help every person in this world. I guess what I'm trying to say is please be aware of what's going on around you, especially for the people you care about. Because trust me, this lockdown, it's one thing, it's been very clear for all of us, we can't fight everything by ourselves. So thank you for watching this episode, and I really do hope there's been a good experience for you watching this. I really hope you understood what it is for a person battling mental health. I really hope you understood how we can help them, even though we are not trained psychologists or psychiatrists. So I thank you for watching the show, and please do spread this message as much as you can.